Hi, my name is Anaya and I'll be teaching you the proper way that you should assist a patient with eating or helping them feed themselves. So first thing first, you want to provide proper hand hygiene. In this case, I'll be using this as my patient as an example. I'll be trying at my best ability explaining everything word by word since I don't have the proper equipment at home. But yeah, I'll try to explain it my best of my ability. So once you've done proper hand hygiene, you want to go ahead and provide privacy for the patients. You want to close any doors or um curtains. Then you want to go ahead and walk in the room. You want to introduce yourself, greet the patient in a nice manner. You want to let them know what you'll be helping them out with today. You also want to identify the patient with two identifiers. I'll give like a brief example on how you should do that. I'm pretending that I'm speaking to a real patient. So you'll want to walk in, and your patient would usually be lying down, but in this case, I'm using this chair as an example on where I would be feeding my patient. So I would walk in like, hi, my name's Anai. Today I'll be assisting you with eating your meal. I'll be helping you out and my best of my ability to help you eat your meal. Um, can I get two identifiers from you, please? Can I get your birthday and your name? Your patient will give you the information. You want to confirm, check the wristband as well, super important. Once you've confirmed your patient is the right patient, you want to go ahead and check your care plan. So usually every patient will have like a unique meal performed just for them that will assist with the best of their needs. Every patient has a different probably diet plan, so you want to make sure you check on the care plan. Does your patient have a specific diet plan? Are they allergic to anything? You also want to check the care plan for do they need any a certain type of assistant while eating, like assistant device. You need any assistant device to get the patient out of bed, or is your patient not able to get out of bed at all? Will you be fully assisting them with feeding them, or you'll be partially helping them out? So those are some important things to know before assisting the patient. So once you've gathered up your information and you're ready to assist the patient, you want to go ahead and let the patient know every single step that you'll be doing just to make them feel more comfortable. So you want to go ahead. So let's say your patient is in bed, then you'll have to assist them fully in bed. Or if your patient is like my patient here was able to get onto this chair. So I'll be teaching you the how I will partially help out my patient. So you want to tell your patient that he needs to perform hand hygiene as well. So you'll give the patient a alcohol-based rub or help them wash their hands. So once they completed hand hygiene, you want to go ahead and usually on a real setting, you'll have like the sliding tables that you roll over to your patient. So in this case, I'll use this flat pillow as a table. I'm sorry about the inconvenience because it's not like the real thing, but I'm trying to use this as an example. So let's say this is your table right here. You want to sanitize the entire table. You want to make sure it's nice and clean and cleared off for your patient. You want to bring over your patient's meal. You want to ask the patient, is this what they ordered? Is this plate the right food that they wanted to eat? So then you want to ask the patient, how can you assist them? Or do they have trouble eating the food? Do you need to feed the entire meal to them, or just do certain things like cut up the food for them? So you'll be like, hi sir, do you want me to fully assist you with eating today? Do you have any trouble cutting your food or getting the food into your mouth? So then depending on your patient's answer, answers may vary. So that an example, my patient here has arm problems, and cannot fully assist the food all the way to his mouth every meal, and has trouble cutting up his food. So I'll be assisting my patient with that. So you want to be very polite as well. You want to let the patient do as much as they can for themselves too, if it's possible, I'm sorry. So then you want to go ahead and ask the patient some questions while you're cutting up the food for them. You want to go ahead and cut the food in small bite size pieces. Make sure they're all cut correctly. You want to ask the patient how was their appetite today? Are they hungry? You want to ask the patient how they like their food. This is a time where they get to choose for themselves what kind of what kind of seasonings they would like on their food. If they would they get to choose how they want to eat their meal. So if they want to start off with the fruit first, or maybe they want to start off with the protein first, it's all up to the patient. So according to the patient, you will feed them, and then you'll provide liquid as asked by the patient as well. So you want to encourage the patient to not drink other fluids before eating, but if the patient asks for a fluid, you should go ahead and assist them with drinking as well. So once you have cut up the food in small pieces, you want to go ahead and take a super small piece. Make sure it's a small pieces, little by little. And I'm so sorry. Before you give them food, you want to make sure that if they wear dentures, that the dentures are placed correctly. You also want to grab the wood stick and make sure do they have gag reflexes. Is super important. Another important thing to before feeding the patient is to you want to make sure that they have any sensitivity in their mouth. You want to go ahead and give them some water or something like that, and see how they do with swallowing fluid. So once you make sure that everything is okay to go and everything seems fine and your patient should proceed eating, you want to take the small bite, gently give the patient. Never, in this case, I know I'm using a fork, but you shouldn't use a fork because you could harm the patient. It's safer to use a spoon or the sporks that the agency might provide you with are probably more safer than to use an actual fork. So once you cut up the pieces, you want to go ahead and gently feed your patient a small, I'm not sure if you could see, I'm sorry, a small bite. You want to let the patient fully chew the entire food and make sure they have swallowed it. Some patients may do something called pocketing. So you want to go ahead and make sure the patient opens their mouth sometimes, and you want to see if they're pocketing any food in their mouth. You want to make sure they swallow the entire food before giving them another spoonful of food or whatever. So you want to make sure that they have swallowed the food. So you want to go ahead and make sure that it's nice and good, it's down. So now you go ahead and grab another, gently feed it. This is the time you get to conversing with a patient, but you keep it professional. You can ask them things about like how they prefer their food. They get to choose what they want to eat first. You want to conversate about healthy options for them, encourage them that healthy eating is really good for them. So then you want to continue feeding your patients small bites and making sure that they have fully swallowed it. And you want to make sure they're not pocketing any food and provide fluids as requested. Now, once you are done feeding the patient, you'll remove the food. You'll slide the table over. You'll provide hand hygiene again for the patient. Then this is when you want to ask your patient if they would want to use the restroom. Then you could go ahead and take them to the restroom. You will want to ask the patient when they want to stay seated or they want to return back to their bed. You want to make them comfortable, cover them up with a blanket, rearrange them. If they want to stay sitting down, you want to offer them like probably a magazine or a book. Rearrange the room around to their satisfaction. Make sure your patient is super comfortable. And you want to make some observations and report to the nurse any observations that you made. You want to go ahead and report how much food and liquids your patient ate and drank today. You want to and did they have any trouble eating? Did you notice anything unusual? Maybe some coughing or choking while eating? Anything that that looked abnormal? You want to go ahead and tell your nurse. Write down all the observations you made. You also want to write down how much fluids your patient drank. You want to make sure to let your nurse know how well your patient did as well. That were they able to did they tolerate the procedure very well, or were they having trouble? All of those things are super important. So when you're done, I'm going to go ahead and provide hand hygiene for yourself as well. And that's it. Thank you.